to talk to you a little bit about peritoneal dialysis. Peritoneal dialysis is sometimes the first step that patients take on their dialysis journey. It is a gentle form of peritoneal dialysis. It uses the body's own function to do fluid and solute and electrolyte exchange through the mesentery that's present in the abdominal cavity, through that mesenteric membrane, through osmosis, diffusion, and active transport to do the exchange of those molecules. There are two types of peritoneal dialysis: continuous ambulatory peritoneal dialysis, where fluid is instilled into the peritoneal cavity, allowed to dwell for a number of hours, and then the effluent or the dirty dialysate fluid is then removed. Often this is managed by gravity, and usually the only equipment that patients have to have at home to manage that are the equipment necessary to maintain sterile technique in a sterile field while making the connections, as well as maybe an IV pole or some type of mechanism to hang the dialysate bag on so that when they instill the dialysate fluid into their peritoneal cavity, they are using gravity to assist in that process. Another form of peritoneal dialysis is the use of a cyclic machine or cycler-assisted machine to perform the peritoneal dialysis. You'll see there are two types of that: continuous cycler-assisted peritoneal dialysis and intermittent cycler-assisted peritoneal dialysis. Continuous cycler-assisted peritoneal dialysis means that there's a machine that instills the dialysate fluid into the peritoneal cavity, and then it removes the dirty dialysate or the effluent, and it continues that cycle throughout the prescribed amount of time that the physician wants the patient connected to that machine. Intermittent cycler-assisted peritoneal dialysis is exactly the same, except it allows the fluid to dwell for a certain period of time before it drains it out. So the machine will instill the fluid into the peritoneal cavity. It will dwell for a certain amount of time, and then that effluent or dirty dialysate will be removed by the machine pump. Peritoneal dialysis does require patients to learn and maintain a sterile technique while they connect themselves to the tubing and when they disconnect themselves to the tubing. They also have to protect the catheter insertion site because it is a very easy place for an infection to occur. There are benefits and risks of peritoneal dialysis. It is a continuous, gentle removal of fluid and waste. This is different than the CRRT that we talked about. This is continuous in that the patient usually will have cycles of instilling dialysate and draining the dialysate throughout the day, or they will have the machine assist them with that at night. Continuous CRRT occurs 24 hours a day and is a continuous filtration. This is a gentle removal of fluid in that it uses the body's own mesenteric membrane to perform that osmosis and diffusion and active transport. It's a convenient form of dialysis because the patient is usually in control of when they perform this. They have the ability to make the decisions about when they hook themselves up for cyclic or cycler-assisted dialysis. If they go to bed at 7 o'clock tonight, then they could hook themselves up then, as opposed to if they want to go to bed at 11. That's their decision. I know of a patient that was able to work a full-time job and have peritoneal dialysis because he could control when he instilled the fluid and whenever the fluid or the effluent was removed based on the prescription or the prescribed time of dwell time that the physician wrote the orders for. There are often less diet restrictions associated with this type of dialysis because there is daily removal of toxins and buildup, whereas with intermittent hemodialysis, there are harsh drops in removal of toxins. So the patient will need to monitor their intake of protein, sodium, and potassium because it builds over the course of a day or two, and then they have that dialysis treatment and those toxins are immediately removed. So there's a harsh shift in fluid, electrolytes, and toxins, whereas with peritoneal dialysis, it's more of a continuous process across every day. As I've said, it is a daily treatment, and so the shifts are certainly less harsh than what they are with intermittent hemodialysis. With every good thing, there comes risk and complications. This does require diligence and attention to detail. There are several steps involved in connecting oneself to peritoneal dialysis, dialysate fluid. There are also procedures and steps that have to be followed in order to remove the fluid and have the effluent come out of the patient's body. These processes can be tedious and complex, and there is certainly a learning curve associated with this. Patients have to learn to maintain their equipment and their supplies. They have to remember to order the supplies so that they have a constant supply on hand. Isis, come say hello. Come say hello. Hello everybody, this is Isis. Thank you for watching all of the videos. I appreciate your attention to detail. And Isis is wearing a very pretty purple bow on her collar. And so if you've stuck with me through all of these videos and you've paid attention through them, on the exam there will be a bonus question that will ask you what was the color of Isis's bow during the video, and you will want to make sure that you answer that the bow is indeed purple. I hope you can see that that's right there. Alright, back to dialysis. One of the highest risk or complications associated with peritoneal dialysis is a very large risk of infection. It is the number one risk associated with this type of treatment. It does require surgical procedure to have the access implanted into the peritoneal cavity. And of course that process actually has risk of its own. So why would somebody choose peritoneal dialysis? Why would somebody want to undergo this daily treatment and requirement of such sterile technique? Well, it's primarily used for patients who have chronic renal failure. It's also used for patients that don't have ability to maintain a permanent vascular access, or perhaps they have exhausted all of their available veins for vascular access. Someone might choose peritoneal dialysis for their convenience. I know that's one of the reasons that my grandfather chose to start his dialysis journey with peritoneal dialysis. And he was able to maintain it for about a year and a half whenever he did contract. Unfortunately, he contracted a peritonitis from that, was hospitalized and was able to recover, but subsequently had to go on intermittent hemodialysis because of that. You would want to consider using peritoneal dialysis in patients that have existing comorbidities that would preclude them from being successful patients using intermittent hemodialysis. So why would you not choose to offer someone peritoneal dialysis, or why would they not qualify for this type of treatment? One of the reasons is recent abdominal surgery. If someone's had a laparoscopic cholecystectomy in the last month or couple of months, you would want to not offer this type of treatment because the wounds and incisions inside the peritoneal cavity need to have time to heal. You also wouldn't want to offer this type of treatment to someone who has had abdominal adhesions or some type of fibrosis of tissues within the peritoneal cavity. Abdominal adhesions and fibrosis would not, the tissues are difficult the tissues would prevent the osmosis and active transfusion or active transport, as well as the diffusion of the solutes and the fluids that are required to have an effective exchange of those things. You would want to avoid using peritoneal dialysis in someone that has an abdominal drain. Anything that you would put in, the dialysate that you would put into the abdominal cavity, would simply come back out of an abdominal drain and would be an ineffective treatment form at that time. You also want to make sure that your patient has the ability and the means to be compliant with this treatment. It does require a lot of processes and a huge learning curve, and also they need access to resources in order to gain their or to maintain their supplies that are required. If someone is non-compliant or non-adherent to current treatments that they're undergoing, they might have a difficult time adhering to the strict regimen that's required to maintain sterile processes related to peritoneal dialysis.